Adults with congenital heart disease. Congenital heart disease is a condition in which one or more structural flaws in the heart have existed since birth. The term congenital refers to a deformity that is present from birth. Congenital heart disease, also known as congenital heart defect, affects how blood flows through your heart at birth. Some congenital cardiac abnormalities may not be life-threatening. Complex malformations, on the other hand, can have life-threatening consequences. Congenital heart disease babies can now live well into adulthood thanks to advances in detection and therapy. Congenital heart disease can have indications and symptoms that aren't visible until you're an adult. If you have congenital cardiac problems, you will almost certainly need care for the duration of your life. Check with your PCP to decide how regularly you need an exam. Signs and symptoms. Some congenital cardiac abnormalities have no symptoms or indicators at all. Signs or symptoms may appear later in life for some persons. And symptoms can reappear years after a cardiac issue has been treated. Adults with congenital heart disease may have the following symptoms. Heartbeats that are abnormal, arrhythmias. The skin, lips, and fingernails have a bluish color, cyanosis. Breathing problems. Exertion quickly exhausts you. Swelling of the tissues or organs of the body, edema. When should you see a doctor? Seek emergency medical help if you're experiencing troubling symptoms like chest pain or shortness of breath. If you have indications or symptoms of congenital heart disease, or if you have been treated for one as a child, make an appointment to see your doctor. Causes. Most kinds of congenital heart disease are unknown to researchers. Some congenital cardiac problems are passed down from generation to generation, inherited. It helps to understand how the heart operates in order to comprehend congenital heart disease. 2 chambers, ventricles, on the right and 2 on the left make up the heart. Blood veins on the right side of the heart transport blood to the lungs, pulmonary arteries. Blood picks up oxygen in the lungs before returning to the left side of your heart via the pulmonary veins. The blood is subsequently pumped via the aorta and out to the rest of the body by the left side of the heart. Congenital heart disease can affect any of these heart structures, including the arteries, valves, chambers and the wall of tissue that separates the chambers, septum. Risk factors. Congenital cardiac disease may be influenced by a number of environmental and genetic risk factors, including your chromosomes. Congenital cardiac disease appears to be inherited and is linked to a variety of genetic disorders. Heart abnormalities are common in children with Down syndrome, for example. During a baby's development, genetic testing can discover Down syndrome and other diseases. Measles in Germany, rubella. Rubella infection during pregnancy may damage the development of the baby's heart while in the womb. Diabetes is a disease that affects millions of people. Diabetes, whether type 1 or type 2, can damage a baby's heart development during pregnancy. In most cases, gestational diabetes does not enhance the risk of birth defects. Medications are prescribed. Certain drugs can cause congenital heart disease and other birth abnormalities if used while pregnant. Lithium for bipolar illness and isotretinoin, Claravis, Myoracin, Xenatane, and others, for acne treatment have both been related to heart abnormalities. Always inform your doctor of any medications you are taking. Alcohol is a depressant. Drinking alcohol while pregnant increases the chances of the baby developing cardiac abnormalities. Tobacco use. A mother's chances of having a kid with a congenital heart abnormality increases if she smokes while pregnant. Complications. Complications of congenital cardiac disease that may emerge years after therapy include heartbeats that aren't regular, arrhythmias. When the electrical signals that coordinate your heartbeat don't work properly, arrhythmias occur. It's possible that your heart beats too quickly, too slowly, or irregularly. Severe arrhythmias can lead to stroke or sudden cardiac death in certain persons if they are not managed. This complication might be caused by scar tissue in your heart from past surgery. Infection of the heart, endocarditis. Endocarditis is an infection of the heart's inner lining, endocardium. Bacteria or other germs enter your bloodstream and go to your heart, causing it to become infected. Untreated, endocarditis can harm or obliterate your heart valves or trigger a stroke. In the event that you are at high danger of endocarditis, it's suggested that you take antimicrobials 1 hour before dental cleanings. Customary dental exams are significant. Solid gums and teeth decrease the danger that microorganisms will enter the circulatory system. Stroke. An innate heart imperfection can permit a blood coagulation to go through your heart and travel to your cerebrum, where it diminishes or hinders blood supply. Aspiratory hypertension. This is a kind of hypertension that influences the corridors in your lungs. Some inherent heart abandons send more blood to the lungs, making pressure fabricate. This ultimately causes your heart muscle to debilitate and in some cases to fall flat. Cardiovascular breakdown. Cardiovascular breakdown, congestive cardiovascular breakdown, implies your heart can't siphon sufficient blood to address your body's issues. A few kinds of innate coronary illness can prompt cardiovascular breakdown. Grown-up innate coronary illness and pregnancy. Ladies with gentle inborn coronary illness can have a fruitful pregnancy. Be that as it may, a few ladies with complex inborn heart deserts are exhorted against pregnancy. In case you're pondering getting pregnant, converse with your specialist about the potential dangers and entanglements. Together you can examine and get ready for any extraordinary consideration you may require during pregnancy. Counteraction. The two people with inherent coronary illness are at expanded danger of passing some type of inborn coronary illness to their youngsters. Your primary care physician may propose hereditary advising or screening in the event that you intend to have youngsters.